I'm joined now by the Health Secretary, Victoria Atkins. A very good morning to you, Victoria Atkins. Thanks so much for coming in. I want to ask you about the junior doctor strike. They are currently on strike. You found extra money to resolve the strike with consultants. Is there extra money to end this strike?
Well, I'm very much keen to negotiate with junior doctors. I was very disappointed when they walked out of the negotiations and called these strikes. I have said if they call off the strikes, we will get straight back round that table and continue to negotiate, because, of course, there isn't just an economic cost to these strikes. There is also a very human cost to this, and there will be people at home watching this programme who are in pain, who are in distress, and whose appointments have been cancelled over these 3-day periods.
Is there extra money, though?
Yeah, we have said that we will find fair and reasonable settlements with those parts of the workforce who have either taken part in industrial action or who are concerned. We want to pay our workforce fairly, and I've been able to find fair and reasonable offers for consultants. I'm really pleased about that. That's out for them to consider at the moment. I've also been able to find a fair and reasonable offer for specialty doctors. That was announced earlier this week, and we were in the process with junior doctors or doctors in training to find a fair and reasonable offer for them. But it is important also to emphasise that this year already, junior doctors have had between 8.1 and 10.3% increases in their pay. And I've tried to direct it to what we've done as a government is direct it to the first couple of years, so that they have the greatest increases in that cohort.
OK, but you are saying that you are prepared to go above and beyond what you've offered already?
Well, we were in negotiations. This is what's so disappointing, is that they walked out, called the strikes, and we were negotiating. And what is more,
but are you planning talks over the next couple of days, though?
If they call off the strike.
Why do they have to call off the strike? A lot of people watching will say,
Yeah.
You've talked about the disruption over Christmas, how yesterday you mentioned how there are people who will have to spend Christmas in hospital
Absolutely.
because there aren't people to discharge them. So why not get round the table now? Why does it make a difference that they're out on strike?
Because the NHS, NHSE is a little bit like an oil tanker. The moment that a strike is called, that has very, very serious consequences for the whole of the system. So for the last week and a half, managers, medical directors, clinicians up and down the country have been devoting days and days of preparation to trying to keep the system stable during these strikes. And for that to continue, we have to have certainty from the Junior Doctors Committee whereby they call off the strikes, then we can go into negotiation. I cannot flick NHS England on and off like a switch. And by the way, this is the principle we apply across the public sector. And so it is right that we treat people, when unions are having discussions with government, it's right that we treat people the same. And we have always said, if there are strikes happening at the moment, affecting patients, affecting the public, we will not negotiate. But the moment they call them off, I will be back round that table.
So in order to call off the strikes in the new year, and there are 6 days of strikes, are you saying that you won't talk to the BMA before then? A lot of people won't understand that.
So as junior doctors know, when I was appointed, within 24 hours of my appointment, I reached out to the BMA, not just the Junior Doctors Committee, but all of the committees on the BMA, to say, come in and let's talk. They came in within a few days, and then officials in the BMA Consultants Committee worked through the weekend. It took a bit of time, but we got to a fair and reasonable settlement. The same is true of specialty doctors, but with the Junior Doctors Committee, they have walked out whilst we were in that process. And so they have called these strikes. These have enormous ramifications for patients and also for other members of staff who are not striking. So when junior doctors are out in the picket lines, their consultant colleagues, other junior doctors who choose not to strike, as well as nurses and other members of the workforce, are having to take up the slack that is there because people are out on the picket lines. So we've said, in fairness to everyone, they must call these strikes off, and then we will continue our talks.
OK, I want to ask you a few questions about our report on homelessness today. How concerned are you about a rise in homelessness, given the government's ambition to clear the asylum backlog, there are a lot of people who are being cleared out of their accommodation, their hotels and their hostels with just 7 days' notice. That's leading to a rise in homelessness. How worried are you about that?
Well, this goes back to the fifth of the Prime Minister's priorities, which is stopping the boats. We have got to stop this flow of boats and illegal migration into this country, and in order to stop the sorts of scenarios that you're describing, because the system cannot cope. British taxpayers are paying £6 million a day for hotels for people who have come here illegally. That is wrong. We have to stop it, and we are doing
But is it
so.
right that they should be turfed out with 7 days' notice? And that puts huge pressure on local authorities, doesn't it, to find them accommodation, and often they're ending up homeless?
It does, but I'm also conscious that there will be people watching this at home who themselves need help with housing. They have been on lists, waiting lists, sadly, for social housing for some time. And so it is a very, very complex situation, which is why we are saying we are trying to stop at source the problem, which is criminal gangs bringing people over illegally. That is not fair on the taxpayer. It's also not fair on other people in society. It's why this is such a, it has, there are a range of views on this, but actually there's also quite a bit of anger from people who feel that they are not receiving the care, the support, the resources they deserve as British citizens, because we are having to deal with £6 million worth of hotel bills a day. And so we want to stop that. And we've had some success, in fairness, because whereas in Europe the number of crossings have continued to increase, here in the UK, within just a year, we have decreased the number of channel crossings by a third.
OK, but what about the 7 days' notice for people to move out of their accommodation? Could you move house in 7 days?
But, well, they are here, they've come here illegally. They will, I know from my work in the Home Office...
Some of these people will have received refugee status.
Yes, but we are working through the asylum backlog as quickly as we can to try and bring some of these cases to a close. But it demonstrates the impact that large numbers of illegal migration has on local services. And I keep coming back to this point. We cannot continue to spend £6 million a day on hotels for people who have come over in small boats or come here illegally. It's not fair. It's also not fair on those people who have come here through safe and legal routes. I'm very proud of having been the Afghan resettlement minister in the immediate aftermath of Operation Pitting and what we saw in Afghanistan. And it took me time to rehouse people because, again, the system is not set up to have thousands of homes free to accommodate people. But we've tried to do that because it's right. These people came through, we welcomed them, they came here legally, and we want to provide a home for them. And actually that has been a real success story and has concluded thanks to the efforts of my friend Johnny Mercer. But we do have to, the problem of illegal migration has many ramifications. This is one of them, and of course we want to help people, but we have to be realistic about what it means for local communities and the resources of the British taxpayer.
We're talking about people whose claims have been approved, though. We're not talking about illegal immigration here, are we?
And again, it's the numbers. So in the last 4 or 5 years, we saw channel crossings move from 300 people in a single year through to 45,000 people last year in channel crossings alone. It is an enormous problem. It is precisely why the Prime Minister is tackling the small boats. That's the right thing to do because the British taxpayer cannot continue to pay £6 million a day in hotel bills.
OK, Victoria Atkins, we appreciate your time this morning.
Thank you.
Thank you.